Hello, welcome to the Happyness of Pursuit podcast. I'm your host, Dr. Raj. I'm a board certified child, adolescent, adult psychiatrist, working with executives, athletes, doing psychedelic-assisted therapy, some cutting edge treatments. I'm here having and the honor of having the great Dr. Lance. Very excited to have you here today, Dr. Lance. I'm just going to go ahead and introduce you real quick. Dr. Lance, double board certified doctor of functional medicine with an extensive background that bridges the gap between traditional and holistic approaches to wellness. He's a U.S. Army veteran and a beacon in the mental wellness community. Dr. Lance is the founder and executive director of Nova Pax Wellness, serves as the functional medicine director at Agile Wellness Group. His journey is not just professional, but deeply personal. He's having navigated his own battles with PTSD and trauma, which he now channels into helping others find their path to healing. Dr. Lance, it's an honor to have you.
Thanks, Dr. Raj. Pleasure to be here, man. Thank you for having me on.
My pleasure. I'd like to start with you, just like I do with every guest. What is your why? What is your mission, Dr. Lance, that you're on?
I think ultimately the mission is to ease pain, help people find their way through their trauma, and to bring more light into the world, as cheesy or colloquial as that may sound. That's really that's what drives me. I want to help people find peace.
That's beautiful. That's I can relate. I think we're very vigilant and mission aligned on that. And tell me, sometimes, often as healers, we're out seeking our own peace initially, and sometimes the best way to get it is to give it as well. And we're trying to solve that in ourselves, and just like another business too, solving a problem for ourselves. And then we end up finding something that works for us that we want to give to others. Can you relate to that?
Absolutely, I can. I think, when we have that call to serve, and a lot of times that manifests itself very early in life, and then we navigate through how we do that, and we pick up the best tools available at the time to help us navigate that space. And as we work our way through life, we find some tools are more beneficial than others, and some tools aren't as good for us. They might be good for other people, but not necessarily good for us. And what I've come to realize is we can be most effective helping others by being lighthouses more than rescue swimmers. There's a time and a place to be a rescue swimmer, but ultimately, if to use that metaphor, if you hop up on somebody else's ship, they're either going to battle you for control of the ship, or they're going to hang out on the poop deck and watch you do all the work, neither of which really benefits them. Whereas if we can just shine light and help them navigate the rough waters, that's where we can be of higher and better use.
Sure, I love that. And like leading by example. Can you tell me about your journey through the military in honor of Military Appreciation Month, Mental Health Awareness Month, and the convergence? I want to hear a little bit more about your military service and how it led you then to where you are, what you're doing now.
Sure. Happy to share. So a long story we won't get into on this podcast, but I turned down a West Point appointment, believing I was going to get an Air Force scholarship. There was a mix-up with the packets, and my scholarship ended up being awarded to someone else. And just with the timing of things, I wouldn't have been able to get that Air Force scholarship the next year because I needed an adjoining room and board scholarship that wouldn't come. So in a fit of anger to punish the Air Force, I enlisted in the Army, to show them. And ultimately, it was a great path. I ended up very quickly being assigned to a Special Forces military intelligence company, where I was a communications expert. We did some work south of the border. This was mid to late 80s. And so there was a lot of, that was really, we were seeing the drug war, and especially cocaine interdiction happening. So I spent some time doing that. Decided I wanted to live long enough to be on this podcast with you. So I took a green to gold scholarship. The military sent me to Embry-Riddle Aeronautical University. So I was able to go to the aviation school that I wanted, just under an Army scholarship instead of an Air Force scholarship. I had visions of being a helicopter pilot, but my eyesight didn't cooperate with me. I had an astigmatism, and these were the days before LASIK. So Uncle Sam, in his infinite wisdom, made me an infantry officer. So I did that for a number of years afterwards. That included service in Bosnia-Herzegovina when the Dayton Peace Accord was first signed. We went into the most hotly contested region, which was the Berchko Posavina corridor region. And we essentially helped de-escalate the situation there, separate the warring factions, clear landmines, reestablish through traffic. We helped facilitate some of the very first democratic elections in that area since Tito took over Yugoslavia. And we were able to stabilize and bring peace in that area. I deployed back from that. I taught at officer candidate school. I was a TAC officer and a senior TAC, and then left the military to pursue entrepreneurial endeavors. Even after I left the military, I continued working in the veteran advocacy space and a lot of work in the mental wellness space. I'd even since high school, I had been in this space. I was a peer counselor, which was an innovative program back in the 80s where high schools would essentially survey all of the kids, ask them who they went to for guidance, for help, if they're dealing with rough stuff. And then all of us got put together. We went through a 40 hours worth of peer counseling training, and then a week-long retreat where we continue to refine those skills. So kind of a didactic and then practicum, and really those fundamentals carried forward to where I am now. And interestingly enough, we just recently relocated to the Conifer area of Colorado, and my daughter's high school has a very similar peer counseling program. So it's great to see that's really continued, at least here on the West Coast.
Oh, beautiful. That's wonderful. Especially she's a teenager, yeah?
She is
Oh,
15
that's
years
great.
old, finishing her freshman year of high school.
Oh, okay. So that's so good that they're now introducing that in the space, especially given how children and adolescents have also been struggling with their mental health and just wellness. And it's good that the schools are intervening and trying to make sure there's support there. Can you, so that's a very fascinating journey through the military. Maybe start a little bit of chip on the shoulder from the Air Force into the Army, then as a communications and infantry officer. And it's funny because when I was going through basic training in 2002 and through the 2000s, when I was a medic in the Army, and that's what led me to psychiatry, just seeing all the PTSD from uh, other soldiers' repeated deployments. We would read like Black Hawk Down in basic training, and then even till like recently in the last couple of years, the show on FX and Hulu, Snowfall. So kind of detailing some of the things you actually lived through with Bosnia, with Black Hawk Down, and then into Snowfall, the drug war. How, I don't know if we should talk too much about it, but the CIA with allegedly being involved with being involved in selling drugs to make money for different anti-communist war uh, with the rebels, and maybe somewhat introducing drugs throughout America, or at least through LA, the Rick Ross story. So you actually like lived through some of that, not maybe knowing at the time the historical significance.
Yeah, I think that's fair to say. And it's interesting. I don't know if you were old enough to watch the Oliver North trials and his concerns in some of the things that he shared. The truth is out there for those that want to seek it. And yeah, it definitely has contributed to the moral injury of a lot of our brothers and sisters that serve, believing we were doing one thing when it turned out that there was maybe something a little less honorable that was actually the driving factor. That's part of what led me to being involved with Moral Compass Federation. MCF was stood up after the withdrawal from Afghanistan and the vacuum that created, and a lot of the moral injury that came from those Marines and soldiers and sailors that had very deep personal relationships with our allies there, and just how unfortunate it was that things transpired the way they did. So, moral injury is a very real thing. And I think, unfortunately, a lot of people don't even realize that they're struggling with it. And it's not it's not in the DSM-5. Part of our work is to hopefully get it included in the DSM-6 so that it is a diagnosable condition, that can then, we can focus on modalities to treat it. There are some overlaps with PTSD and even TBI. If you were to look at a Venn diagram, and it looks, each circle kind of covers, and there's so a lot of the modalities that we use for one can be used for all three, but each has their own distinct differences as well. That was a little bit of a rabbit trail, but I felt it was
Oh
relevant
yeah,
to the
and
conversation.
sure, like key things are related to the PTSD, as well as like survivor guilt. Definitely see a lot of that in the veterans every week, as I'm sure you do, and experienced firsthand with different comrades and possibly yourself.
Sure. Absolutely. We, I think when we go into military service and first responders go into service, when they go through their service schools, we get programmed, we get, I'll say encouraged, and I'll put that in quotes, to be very externally motivated, externally focused. And so we're looking to see where we fit into the structure, where's our rank above and below, and the orders that are coming down to tell us what we need to do. And it starts off in basic training. That's an extended significant emotional event, and that's a conditioning to get us to where we're looking up for validation, from somebody that's got more rank. And then the first thing you do is you're looking at collars, you're looking at the front of the chest to see, okay, who's that, what's that person's rank? Where do I fit in with them? You're doing the lane to see if there's a combat patch. You're looking to see if there's a Ranger tab or a Special Forces tab, just to figure out where you fit in. And with that external motivation conditioning comes a conflation or a collapsing of service and sacrifice, to where we are conditioned to believe that we're not truly serving unless it's costing us, unless there's sacrifice. And that's unfortunate, especially when we step out of the military, because then there is no structure. There is no kind of cool down program to bring us back into being internally motivated, externally focused. And we see so many of our brothers and sisters just kind of lost, and not feeling like they're plugged into something bigger than themselves, and serving a greater mission. And that creates a void. And so then you look to fill that void, and that is a significant emotional event as well. And it's a traumatic emotional event, that suddenly I have no community. So what do I do? And so you look around for the available tools, just like we did when we were little, available tools. And sometimes those tools are productive and sometimes they're not. And so coming back to that survivor's guilt, that's that service sacrifice conflation. It's like, I shoulda, woulda, coulda, right? I should have been there. I would have done something different. I could have made a difference, but
Mhm.
you know, a lot of the struggle we have is struggling with the past, and we can't rearrange the past no matter how hard we try.
Sure.
So a lot of the work I do is helping people, and I'm sure the work that you do as well, Raj, is helping people accept what is. There's that saying, it is what it is. And another friend of mine, Dr. Jason, he's like, no, it just is. And if we can just get to
Right.
the point of where we realize it just is and find peace with that, then that's where the healing can start.
Sure. Requiring a degree of serenity, like as in the serenity prayer, to accept the things out of your control and get peace with that, including the past, uh, what others do, as well as what we've done in the past, which we can't change. It just is. And also, and this is where psychedelic assisted therapy really works well with the ego dissolution and the increase in empathy, empathy to others, empathy to yourself for forgiveness, forgiveness to yourself, forgiveness to others. And you have a lot of extensive experience with that too, right?
I do. The Buddha said, compassion, you don't truly understand compassion until you have it for yourself. And that's a beautiful thing, because there's a level of hypocrisy if we're willing to be compassionate with others, but we're not willing to give it to ourselves. And many times that's rooted in our childhood. Um, with things that we go through in childhood, there's a very high proportion of those that go into military service, that go into medical service, that become first responders and law enforcement, that had very difficult childhoods. And there's a remarkably high number that have complex PTSD that came from those formative years. And so we go into those organizations seeking that leadership, seeking that we either go in looking for the leadership that we didn't get, looking for the compassion that we didn't get, or we go in saying, you know what, I didn't get it, but I'm going to fix it for somebody else. And a lot of times we end up in those environments, and the people above us, in rank and time, went in looking for the same thing. And so they're still broken. They didn't find the answers. And so then, we sometimes have dysfunction that rolls downhill and continues to roll downhill. So then not only did we suffer generational trauma in our childhood, now we're suffering generational trauma in
Mhm.
our service. And then it's like, well, what the hell do we do? So, the thing with the psychedelic therapy, and I've mentioned it a little bit. I've developed what I call the available tool concept, which, I'm an ex-infantry guy, so I think in word pictures that helps me a little easier. And so if we think of a tool bench, and when we go through a significant emotional event, either bliss or trauma, we cast around for tools to help us navigate that. And sometimes it's good stuff. We're 13 years old, and and the cute girl across the classroom lets us know in no uncertain terms she thinks we're cute. So then our patterns change. Now suddenly we discover showers on a regular basis, and we discover Axe body spray because we're going to modify our patterns to navigate that significant emotional event in a positive way. 3 months later, she breaks up with us, and we discover Blue October and all of that really deeply emotional music to help us kind of process through. We pick up a new tool. Sometimes those tools are productive. Sometimes, and it might be academic performance. It might be sports. Sometimes they may not be so productive. As we get older, we'll pick up alcohol, or we'll pick up porn addictions, or we'll pick up, bar fights or high risk behaviors, to help us navigate, and also to fit that what has become our new default mode network baseline. If our sympathetic nervous system is used to being charged, and our vagus nerve is used to being incited, and that's become our baseline, then our subconscious says, well, we need to stay in that space. And so if we don't have that stimulation to release the cortisol and the adrenaline, subconscious will start manufacturing stories to help us get there. And then we're back to using those errant tools sometimes to to create that sense of, okay, now we're supposed to be.
Mhm.
The thing about using psychedelics is now we can create that significant emotional event internally, but the psychedelic medicines allow a bit of a disassociation from the pain of the trauma, so we can almost view it, instead of like in a video game when we're in the first person shooter position, we get to observe it from the third person position and see more of the landscape around it.
Mhm.
And it does incite empathy, and it does incite compassion, and it creates pliability in the psyche. So some of those old tools can be laid to rest and new tools can be picked up. The tools that we use to survive are not the same as the tools we need to thrive. But if there's no pliability in the psyche and the subconscious is going to hold on to what it's used to get you to that point, because there's no moral compass there.
Mhm.
This is what we've done to get here, so we're going to keep doing that. And so in some of those behaviors sometimes become addictions. And so if somebody can't kick an addiction, it's not a moral failure. It's not a lack of integrity. It's not a lack of motivation. A lot of times it's a lack of understanding of the interplay between the frontal cortex and the subconscious, or the conscious brain and the subconscious, or the frontal cortex and the amygdala. If we understand that the frontal cortex programs the amygdala or the subconscious, but realize our conscious thoughts only dictate 10% of our behavior and our subconscious dictates 90%, we've got to reprogram the subconscious, and that takes time, and it also takes pliability in the psyche. So that's where psychedelics really, really help, because they kind of heat up the metal of the subconscious, if you will, in the forge, and now it's hot and it's pliable and we can work it. And as long as we work it into a new form before it cools off, then we see lasting effect.
Mhm.
um
Yeah, those are,
Go ahead.
sorry to interrupt. I was to say those are a couple of the main ways. I also like to explain how it works so well. Psychedelic assisted therapy. Well, so in Florida, right now it's ketamine that's legal, and MDMA and psilocybin might be around the corner in the next couple of years, right? So
Mhm.
pushing people through the tunnel to experience the trauma in a way, not from lack of trying, but with normal talk therapy without the psychedelic, is very difficult to do. Just part of the nature of trauma is avoidance of wanting to think about it, wanting to talk about it, right? So and then so you get the exposure piece, which is important for reducing any anxiety, face the fear, right? Face the trauma, and exposures where to the point where you can take the burden off of your shoulders. It's something that happened. It's a chapter that happened to you, but it's not has so much emotional valence as just the few points of memory that people often have with trauma. When you're experiencing it, and now with a good trained therapist, you're able to process and metabolize it. Now you can remember, but not ruminate and perseverate and have the shame with it, relieve some of that moral injury, the survivor guilt. We can work through that, do cognitive behavioral, like trauma focused cognitive behavioral therapy with it, psychodynamic therapy, to get into that unconscious material, sometimes back to childhood too, not even just as an adult with combat trauma, because sometimes that trauma is adding up on each other, right? And we can kind of heal
Sure.
those wounds from the past that are the cause of the depression, anxiety, PTSD, pain, addiction now. And then the learning piece is the other huge thing, as you mentioned, like being able to put down new pathways, make change in your behavior, change in those thought patterns. Because normally with talk therapy, as we know, and the more you're struggling with your mental health, the more difficult change can be. So the psychedelics power to have neuroplasticity, rewiring the mind and body to have new ways of thinking, new behavior. That makes a huge difference when you integrate the new lessons from the psychedelic assisted therapy. And then with ketamine in particular, out of the psychedelics, you have the dissociation factor where you can observe it, like you said, like a movie, that whatever the vision is, so to speak. Carl Jung said, I have it on a mug in the office. We forgot the age old fact that we see through God's eyes in our dreams and our visions. So to me, I call it like a vision almost. What's happening,
Mhm.
both is kind of that unconscious material, just like dreams. And I've heard a guest, I forget what his name was, on Tim Ferriss talk about. on his show that he was able to observe the things that are causing him anxiety when he did ketamine assisted therapy and recognize like it wasn't such a big thing as when how it normally seems, the things he was anxious about. When he saw it that way, he was as like a third party observer, as you kind of mentioned, and life is play. And he kind of like reminded him of that, and that kind of helped. And then people say that afterward that they feel lighter. I'm sure you've heard that too. They feel lighter, their mood, their anxiety better. They don't no longer have to use whatever substance or whatever addiction we're talking about. Those behaviors go down, as well as with ketamine, the pain also. So, and they're all like interconnected with mind body connection, right? So,
Sure.
tell me about your experience with like the psychedelics that you use the most with your clients.
Sure, sure. Happy to. And I love a lot of the points that you brought up. And you talked that the mind-body connection, the clients that I work with, my personal opinion is it's a three-legged stool. It's physical, physiological, it's mental, emotional. And then the third leg is the spiritual / community, being plugged into something bigger than yourself. Because if we don't address all three, then it's like balancing on two legs of a three-legged stool. Or if we really hyper focus on one but not so much on the other, well then it's a stool that's got one leg that's very long and the other two that are very short. So always try to integrate all three pieces, and even the spirituality to me doesn't matter, as long as it's something that provides peace and comfort. Whether it's Buddhism, whether it's Christianity, whether it's Islam, whether it's Judaism, as long as you can recognize that you're plugged into something bigger than yourself, and for some people, even agnostic or atheist, then it's community. It's serving a higher purpose. We as
Absolutely.
humans need to do.
And that's
So
one of
as
the
far as
biggest things too, right? With psychedelics is that increased feeling of community, connection, love. You could say
oneness, yeah.
spirituality, oneness. It's, you know, a mystical experience. It's not just psychopharmacology. It's that's a key part of our process and method as well, is just establishing the community aspect, the connection spiritually, but also whether you say it's God, just love, oneness with the world. That's a key thing that psychedelics, part of their magic of what they can do, right?
100%. I can tell you from my own journey, even being involved in this space in counseling, coaching, I definitely had my struggles that were unresolved, and a lot of them, as you mentioned, went back to childhood, and I was a highly functional alcoholic. I, at the peak, I was going through between a half bottle and a bottle of bourbon a night. If it was a half bottle of bourbon, sometimes there was a half bottle of wine that went with it as well. And I was sliding down that slope, but there hadn't been quite a significant emotional event for that behavior pattern to change. And sometimes you'll see a change in people if they get a DUI, or they're facing a divorce, or they get in a car wreck, or they get a diagnosis of psoriasis of the liver. Then suddenly we'll see changes, because now there's that traumatic significant emotional event to shift it. So for me, it was going through the plant medicine. I had the privilege of meeting Justin Lepre with Heroic Path to Light, which is now Illuminating Heroes, and he invited me to come through a healing retreat in Austin, Texas, where the organization's headquartered. And at the time, finances weren't great, and I said, I don't think I've got the resources, and it was a beautiful moment. He said, "Brother, I didn't ask you if you could pay for it. I asked you if you wanted to come." And that was just that beautiful giving was really impactful. And so I went through, I prepped, went to Austin. And so the prep included microdosing of psilocybin. And so Illuminating Heroes is set up as an entheogenic church in Texas. There's a lot of acceptance in the Austin area for the work that's being done there. So we went in a cohort of 10 of us, and we went through the medicine. So that there was a lot of pre-integration work, a lot of setting intentions. And as you know, working with ketamine, set and setting are so very important, because you know, what you take in is what you're going to experience. And especially with the synthetic medicines like ketamine, there definitely need to be some very strong guardrails around the experience. And so we microdosed psilocybin. We went through a very impactful workup with breath work, with Leland Holgate, who's a phenomenal breath work master. He takes Guizhong and Kundalini and Wim Hof work and Stan Grof, and he's really just brought all of these things together and put them together in a package that really resonates with with those of our community and first responders. And so we had that pre-workup. Then we went through a very profound psilocybin journey that was actually facilitated by Zach Leary, who's the son of Tim Leary.
Yeah.
He picked up his father's work and continued on. So it was really an honor to meet Zach and get to know him and be able to count him as a friend now. Then we had an integration day, and then the next medicine was Bufo alvaris, or 5-MeO-DMT from the Sonoran Desert Toad, and that. So the combination of those two was incredibly profound to dissolve the ego, to bring healing, and to your point of desensitizing. When I came through the psilocybin, and I was able to find compassion and empathy and forgiveness for my parents and for myself, this flood of beautiful memories from my childhood that I hadn't thought about in decades just really came in. And it was amazing because, that neuroplasticity that we're talking about, not only is there rewiring from the psychedelic medicines, but there's repair. Because when we take trauma to the brain, whether it's physical or psychological, those areas get downregulated. In the brain, we've got 100 billion brain cells, so it's going to reroute around that. It's going to detour around it. Then the myelin sheath of those neurosynaptic connections strengthens. And so, those impulses are going to follow the detour easier than that downregulated area that's not as conductive. But the psychedelic medicine lights everything up. And so then all of those memories, all of those experiences, feelings get to be experienced, but not just in the traumatic sense. The healing allows it to be to be experienced in its entirety, good, bad, and indifferent. But that balancing allows things to reset in a very settled way. When we talk about trauma, sometimes when I work with clients, I'll tell them, have you ever burned yourself? And then when you get close to a stove, that one area really, it's like, ooh, that's hot. The rest of so like if you were to burn your finger and hold the burned finger close to a warm stove and an unburned finger, the one that was burned, you're going to feel it a lot more because there's a sensitivity there. Going through the psychedelic medicine is almost like that tenderness go away. Now you can feel it for what it actually is, and not the hypervigilance that we sometimes experience.
Right. Correct. Yeah, just like filling in the narrative completely, and it actually happening like a movie is so healing. Normally, if you did like trauma focused cognitive behavioral therapy, it would take several sessions to get the kind of exposures, and this is a much more accelerated, powerful healing.
Yeah,
Not just go ahead.
Well, and several is an understatement. Yeah, there was a hypnotherapist that I worked with when I was still enlisted, as an alternate form of healing. And he likens complex PTSD to seaweed. Like if you go to the shore and you see a big bed of seaweed, sometimes you'll see that kelp bed, it'll come and then it'll keep going. And sometimes it'll stay. And he said, look, if you go in and look under the kelp beds that get bigger and bigger and bigger, you're going to find water plants that are rooted in the ocean floor that come up, and then that seaweed wraps around them. And so And so sometimes you'll see the kelp beds float by and sometimes you'll see them stay and grow. And he said, those that don't have childhood trauma, they're like that kelp bed that comes and goes. And if the kelp is trauma, a traumatic event, it'll come, they'll work through it, and then it'll go by. But if you've got complex PTSD or complex trauma from childhood, those are the roots in the ocean floor. And so then the additional trauma just kind of piles on. And now this bed's getting bigger and bigger and bigger. And so that cognitive therapy piece that you're talking about, it's kind of like taking a rowboat out and pulling one string of seaweed at a time and throwing it out into the ocean. You get there, but psychedelic medicine's like going in underneath and just pulling all of those little water plants up by the roots. And so now there's nothing rooting it, the whole thing can flow by. So another imagery word
That's
picture
beautiful
for you.
imagery. Yeah. So tell me, what's kind of I mean, you hit on some, I want to double click on some of the key points you mentioned. You mentioned the breathing, the breath work before, which I also recommend highly, like at least holotropic breath work, or I don't know tons about Kundalini and the other ones, but that's I've heard also very, very good to do before starting the psychedelic assisted therapy. You get better result. Uh, and there's a good app too. I don't know if you've ever seen State app. Have you ever tried that? It has like really good for people who really struggle to like, what do I do? Like start that. It gives you 3 to 5 minutes of breath work. At least that's a kind of easy, simple way to get your foot in the door. Uh, then when you kind of go into the psychedelic assisted therapy, you can really like manage higher and higher levels of difficult experience and visions as well.
Absolutely. The very basic is a box breathing, right? So it's in for the count of 4, hold it for a count of 4, exhale for a count of 4, hold empty for a count of 4. That's something that somebody could do right now. Leland's program that he put together is called the Willful Warrior. Phenomenal. That's available as an app and also as courses to be able to take. Leland actually healed himself from being a quadriplegic using breath work. He was in an accident while he was on active duty. And so again, phenomenal resource. And he's just a great guy. But breath work is really important because it helps balance our sympathetic nervous system and our parasympathetic response. And it helps kind of round out vagus nerve. Our vagus nerve is our fight or flight, which is actually fight, flight, freeze, or fawn. And really all of our vagus nerve responses, our sympathetic nervous system responses start off with freeze. Because if you're getting ready to lift a heavy weight, or you get an email from somebody that you don't want to get it from, or you see the phone ring and a name pop up that we don't want, first thing we do, our breath catches, right? So that's the freeze, and then we'll go into a different response. If we grow up in abusive homes, sometimes that response is a fawn. We give people what they want. It's like throwing meat to dogs that are attacking you so you can run away. Sometimes it's flight. Sometimes it's fight.
So I've heard the other
yeah,
F word. I've heard the other F word too. The PG. We'll keep it PG. That's also
fornication.
Yeah. Oh, there you go. Good. Keep it PG for the kids if they're watching.
Yeah.
No,
Yes.
that's a really good point. And breath work, just breathing, 4-square breathing. That's whether it's adults or kiddos. Sometimes it's just whether it's children's books or just something simple like that. And that's why I kind of mentioned State app was you want to give even adults, I feel like the easiest entryway in, the baby steps to make sure they can get that activation energy just to start with the simplest, smallest thing, right? And 4-square breathing, it's that coping skill. When we talk about coping skills, everyone when they're struggling, make a safety plan if they're like having unsafe thoughts or urges when it gets to even to that level. Start with the breath, right? Because it's that one thing that can bring you back to the present, and the people who live in the present are the happiest when we study happiness. So it's just kind of the simplest thing. We all do it involuntarily, but if we can do it voluntarily, make little adjustments on it, it can have such huge power, right?
Absolutely. You mentioned happiness. Have you looked at any of Coach Sherzad's work?
No, can you tell us?
Yeah, so
Not
so
familiar.
he so Sherzad we've got IQ, which is, intelligence quotient. We've got the EQ, which is the emotional quotient. And then he's got what he's coined as the PIQ, which is the positive intelligence quotient, where it's a series of reframing and essentially helping to shift perspective so we can get out of victim mindset, get into victor mindset. We can look at every situation we face as an opportunity for growth, and just really moving into a positive mindset. Dr. Tal, who works at Centenary University, and Shirzad work together. Centenary is a small college in Hackettstown, New Jersey. They've actually got a master's degree in happiness, the first in the nation, and their folks go into corporate America and help make tweaks and changes to the culture within those organizations, to increase sense of well-being and help people just find contentment in where they are and the job that they're doing and their career paths. So Shirzad has what he calls PQ reps, and so part of going through his coaching course, it's a 6-week course, is really working on the physical and the physiological to interrupt some that vagus nerve response. And so great resources there. I've kind of taken some of his things and put them together with other things that I've learned and come up with a quick hack if somebody's feeling anxious, or
please.
having an anxiety attack. It's really simple. You take your fingers and you hang them into your ears and pull down. So that's going to grow out your vagus nerve. And then you close your eyes and you breathe in and you pay attention to the difference in the temperature of the air around your nostrils and anything else that's coming into your brain. You just, no, we don't have time for that. Nice deep breathe in, and then you hum out, because the hum is also going to help ground out that vagus nerve response. So nice deep breath in, and then you hum it out 3 times. Deep breath in, slow hum out. Deep breath in, slow hum out. Deep breath in, slow hum out. Observing the difference in temperature around the nostrils.
Interesting. And that's just such a mindful experience right there. Like just paying attention to the senses. Sensory.
Right. So what that does is it grounds out that hypervagus nerve response. It incites parasympathetic nervous system activation and gives you a minute to settle down.
I love it.
That's been a very effective for clients. Yeah.
I love it. And even what you mentioned about every opportunity, every challenge is an opportunity for growth. I think, and that's the whole reason I loved or went with this name of this podcast, because that idea to me of the happiness of pursuit, that we're in a constant, like that's the sweet spot of happiness, is pursuing a little bit of growth, little baby steps of growth and progress, and pursuing a goal, overcoming challenges, using them. Everything is a positive experience in that sense, even the toughest ones, because you're learning something. As long as you don't quit and you keep getting up and trying to get better, to grow, to progress, that's a continual like dopamine, not needing small hits of dopamine, as opposed to that.
Yeah, absolutely. Another story that I use with clients just to kind of help them process through things that have happened. There's a story of this sculptor in India who created very, very lifelike sculptures of elephants out of large rocks, to the point of where you would stand by it and really question whether it was real or not. And he was asked once, how is it that you make these sculptures so lifelike? And his Zen-like response was, I simply remove that which is not the elephant. And so in the same way, as we're navigating through life, the things that get removed from us that aren't truly us allow the masterpiece, which is us, to come out. So now if we take that a step further, then the chisel and the hammer are neither good nor evil. They're just simply tools that help reveal the best parts of us. That takes a little bit of work to get there, but when you can get to that point, then you realize life isn't happening to us, it's happening for us. And when we can be in that place, then we can approach each challenge that we face as an opportunity. And it's like, okay, how is this sculpting me to be an even better version of myself?
Absolutely. I know you have to go soon. Let me get start to little wind down. I wanted to ask you, when I connected you on LinkedIn, your name was listed as Clarence Lance Charles E. Cutworth. Can you tell us a little origin story of your full name and what it feels like to be the most light-skinned Clarence I've ever met?
Oh, that's funny, and I appreciate that. Yeah, in my military service, I met four other Clarences, and by far I had the least amount of melanin in my skin. Uh, so how that came about, my father was military as well, and when he was in the Navy, he did some cleanup and some radiation reading testing after A-bombs were fired off, and as a result of that service, was told that he was sterile. So he and my mother got married, and my mother was actually in an automobile accident, went to be checked out, and lo and behold, found out she was pregnant. And that was quite a surprise for everybody. And my father was one who had, let's just say, he had picked up tools to help him navigate life that included brown bottles, and it was also it had quite a sense of humor. And so they got worked out. There was no doubt that it was, that he was a father, that it was me. Yes, he wasn't sterile. Anyhow, so all of that resolved. But then when my mother went into labor, they lived in this little town, Mentone, California, and they had to drive through Redlands to get to the community hospital. And the main road to get to the hospital passed by my father's top three favorite watering holes. And so he's driving the truck and looks over at my mother, and how far apart are your contractions? They're about an hour. Oh, okay, great. I'm just going to pull over and grab a quick drink. And so he goes into his first watering hole, and he was absolutely convinced I was going to be a girl. And so never one to shirk an opportunity, went in and said, hey, my baby's coming. We're on our way to the hospital, but I've got time for a drink. Who wants to buy me a drink? And whoever it was that started buying him drinks, he's like, you know what? If it's a boy, I'm going to name him after you. That was great. So there was Tom, let's say. And so then he hops in the truck, driving to the next one. How far apart are your contractions? They're about 40 minutes. Oh, we've got time for another drink or two. Pulls over at the second watering hole, and my mother patiently waits in the truck. He goes in, same thing. If it's a boy, I'm going to name him after you. Comes staggering out. So my mother's like, okay, I need to drive. And so now my pregnant mother in labor is driving.
Wow.
And passes the third watering hole. My dad's like, how far apart are your contractions? 25 to 30 minutes or so. We've still got time. Pulls into the third one. Same thing repeats itself. He goes in, gets a couple of drinks, totters back to the truck. They show up. My mother's contractions are 15 minutes apart. A little while later, I come out, and lo and behold, I'm a boy. So my name Clarence, I'm actually named after my great grandmother Clara, who was the consistent parent figure for my father. He had a pretty rough childhood, and she was one that was always there for him. Charles was named after my great uncle Charlie, who was actually he was on Bataan when the Japanese forces took Bataan. He was a part of the 300th Coastal Field Artillery, and managed to escape. And so he was a resistance fighter during the Bataan Death March and all of those things. Just an amazing man. And then, so that's the Clarence, that's the Charles. The E on my birth certificate stands for everybody else that wasn't named in the first two names, Cutsforth. So when he went back to the bars and they're like, you didn't, what, so how's little Tom doing? No, it's not Tom. It's actually Clarence Charles E. What do you mean? You said you were going to name him after me. Well, I did. The E stands for everybody else. You included.
Captures everyone.
Yeah.
Now we see
So that's how
where
he
you got
navigated that.
your resilience and personality. I could see that from that story. Your parents get to the
I
hospital.
appreciate it.
We have a tradition, Dr. Lance. Each guest will leave a thoughtful question for the next. And the question that the last guest left for you, if that's okay, is
Sure.
he wanted to hear, and I think I might know which direction you'll go with this, is listening more or less important to communication than speaking in your experience? How would you respond to that, especially in the context of therapy and healing?
Oh, listening is paramount. That God gave us 2 ears and 1 mouth for a reason. We need to listen twice as much as we speak.
Absolutely. And you doing the therapy work you've done, the healing, it's much more passive in the sense of like, I mean, listening is a very active process and that we all could be better in, I feel like, but it's more passive in the sense of like listening and less speaking. But that's a lot of work in itself, right? To do it well.
It is. And there's a big difference between hearing and listening.
Oh yeah.
And active listening. So many of us, and I'm definitely guilty of it, when we're in dialogue and we tend to listen just enough to find the jumping point for the next thing we want to say, versus holding space and just listening and just letting somebody be. I've found most conflicts resolve if you can just be quiet long enough to let somebody get everything out, get it all out. And so there's no more resistance left. And then you kind of sort out the pieces. Okay, thank you for sharing that with me. Now let's figure out how we navigate through that. That's so much more important than, no, I'm going to tell you.
Right. And I think, just naturally from ego like from that perspective, we're wanting to see how, and not necessarily in a negative way, just wanting to see where we can connect and have that jumping off point, as you said, to keep the conversation going. But sometimes holding space, I love that way to put it. And just empathy, I think, comes from that, right? Like just trying to understand where that person's coming from and being able to accept whatever emotions also are coming with it and giving space for that and then mirroring it back or um thanking them for sharing with you. Like that's a huge way to get put, as the Gottmans call it, bids and calls, right? To improve the intimacy of the relationships we have.
There's one more. There's a story about the Buddha that I really like. The Buddha would teach, and he would gather people together and share his perspectives. And there was this guy that was a heckler, and whenever he saw the Buddha teaching, he would show up and he would heckle and he would defame and he would call names and just say all of these terrible things to the Buddha and about the Buddha. And so one day Buddha was walking a road by himself, and this man came riding by on a horse and saw the Buddha by himself, and he hopped down and he starts berating him and tapped him on the chest, and you're worthless and you're leading people astray, and you're a fake and you're a phony and you're a hypocrite and da 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 da. And the Buddha's face was just serene. And finally the guy said, "Don't you have anything to say for yourself?" The Buddha thought for a minute. He said, "There are two men. One man has a gift. Man number one has a gift he wants to give to man number two. And man number two refuses to accept the gift from man number one. To whom does the gift belong?" And the heckler thought for a minute and he said, "Man number one." And the Buddha simply smiled and turned around and walked away. So in our engagements with people, if we can remember that whatever it is that somebody is saying, whatever it is they're trying to give you, it's only yours if you receive it. But it's 100% theirs if you don't. And that helps us find peace, because very rarely is something that somebody's giving about us. It's almost always about them.
So true. Yeah, we could learn so much from Buddhism, for sure, and the Buddha. Tell us, Dr.
I
Lance.
think there's truth. Well, there's truth everywhere. And if we're open to receiving those fractals of truth, then that helps us assemble our piece.
Absolutely. That's beautiful. Dr. Lance, tell us, where can people find you and learn more?
Yeah, and as you mentioned, I'm on LinkedIn, so you can definitely find me on LinkedIn, Instagram, at Novapax Wellness. We'll be spinning up a website soon. We just pulled it down to do some retooling based on some additional innovations that we've added to our multimodal therapy with Novapax.
Beautiful. Thank you, Dr. Lance. I appreciate you coming on and sharing your wisdom with us.
Well, Dr. Raj, thank you so much. And I'm excited for what the future brings with us staying connected and collaborating.
No doubt. Take care. Have a good rest of your day.
Thanks, my friend. You as well.
Bye-bye. Thank you.